Okay, I'm going to go ahead and get us started, and we'll probably have a few folks joining us here. Thanks, Kenneth. No problem. Okay, good afternoon, and welcome to the Identity and Innovation Summit. My name is Molly Cook with the Illinois Center for Specialized Professional Support, and I will be helping with moderating technology today. This lunch session is Managing Chronic Disease in the Workplace, BIPOC Perspectives. A couple of housekeeping items before we get started with our presenter. Currently, all attendees are muted. You have the ability to mute or unmute yourself. However, we ask that you remain muted unless you are speaking to reduce background noise. In addition, we invite you to post your questions in the chat, and we will address those throughout our time together. This session will be recorded, and you can locate the recording on our Illinois Workforce Academy website following the end of the summit. Now I'd like to introduce you to our speaker, Donald Dew. Thank you for taking time to present today, and you can go ahead and take it away.
All right, thank you so much, Molly. As mentioned, my name is Donald Dew, and I'm President and CEO of Habilitative Systems, Inc. We've been serving Chicagoland communities since 1978, and we grew out of a church ministry, a church by the name of Clare Christian United Methodist Church. And in 1978, we started out with 3 programs. One program for adolescent boys who were wards of the state. Another program was the Rotary Club, dealing with folks battling alcoholism. And the third program component was for sheltered work, providing work simulation activities for persons with developmental disabilities. Since that time, we have been involved in a number of different major innovations and collaborative opportunities targeting persons most at risk and most at need. We've operated programs for infant mortality reduction. We led that effort in the Austin community. During those years in the 80s, the infant mortality rate was synonymous to third world countries. And we wanted to really impact on that rate. And in fact, we're able to lower that rate. We also were able to lead the deinstitutionalization movement in the mid 80s and formed the Case Coordination Consortium of Central Chicago. We traveled to 5 different state facilities throughout Illinois, identified persons who could benefit from community-based placement, and were able to secure their discharge and get them into different organizations providing both day and residential services. We also led child welfare efforts and became one of the largest African-American led child welfare agency in the state of Illinois. During those years, the census and DCFS had grown to over 50,000 kids, and the majority of those children were in fact African-American. We also were a participant back in 2005 with something that is, of course, the subject of today's conference, in part around HIV, and really providing support for persons living with HIV. So back in 2005, we formed a collaboration with the University of Illinois and the Community Mental Health Council led by Dr. Carl Bell, noted psychiatrist, because primarily we wanted to come up with a community-based research approach to really identify children who have been exposed to HIV/AIDS and were also having mental health challenges. And of course, to oftentimes go hand in hand. The experience of this challenging disease certainly creates significant trauma, significant challenge, and you can imagine the extent to which our children were challenged trying to go through the school system, many of whom were involved in the child welfare system, and of course, many who also were involved in the juvenile justice system. So today, I'd like to talk a little bit about a number of different aspects, and of course, the core intent is to talk about how do we manage chronic disease in the workplace and looking at various BIPOC perspectives on it. But I wanted to give you a full range of information and really kind of hone in on some of the most significant challenges when we're looking at a multiplicity of issues that are affecting persons of color who also have disabilities and who are trying to be gainfully employed. Molly, can you go to the next slide? So again, Many may know this already, but I wanted to start with a general definition in terms of a general synopsis. Disabilities can affect people in different ways. Even one person has the same type of disability as another person. Categories of disabilities certainly include various physical and mental impairments that can hamper or reduce a person's ability to carry out their day-to-day activities. Next slide, please. A disability is defined as a condition or function judged to be significantly impaired relative to the usual standard of an individual or group. The term is used to refer to individual functioning, including physical impairment, sensory impairment, cognitive impairment, intellectual impairment, mental illness, and various types of chronic disease. And when I referenced the Kids Coordination Consortium of Central Chicago that we operated back in the mid 80s, that clearly was focusing and targeting persons with intellectual impairments. And again, some folks would often ask, well, how'd you come up with the name habilitative systems? Well, we often say that, for many of the persons that we work with, they were actually born with disabilities, developmental disabilities. So they were never at a point of normalcy in their lives, and certainly were in a position of trying to habilitate, and hence the name, creating opportunities for growth, creating opportunities for development. And anyone who has been experiencing limitations in their functioning, impairments, et cetera, were really about one thing, and that is trying to create opportunities for growth, opportunities for development, opportunities for an increased standard of living. Next slide, please. So if you have not already seen a definition of social determinants of health, it's important that we bring this focus into the conversation. The CDC, Centers for Disease Control, and the Healthy People 2020 website gives a definition for social determinants. And these are the conditions in which we are born, live, learn, work, play, worship, and age. These are in fact known as social determinants, or often also called social determinants or drivers of health. They have a profound impact on our health, and they influence the opportunities available to us to practice healthy behaviors, and also the ability to enhance or limit our ability to live very healthy lives. Next slide, please. Further, this particular report indicates that differences in social determinants of health contribute to the stark and persistent chronic disease disparities in the United States. And in the earlier sessions, you heard a lot of reference to health inequities and disparities. Well, when you hone that down even further and begin to look at these disparities as it relates to race and ethnicity and various socioeconomic groups, we realize that this systematic limiting of opportunities for members of certain groups can in fact affect one's health. So it represents, in essence, a public health crisis. In fact, in Cook County, recently the County Board of Commissioners voted unanimously to indicate that mental illness in Cook County was in fact a public health crisis, and very, very significantly impacting scores of individuals. I was on the call earlier this morning, and we were talking about the rise in suicide rates among first responders. And I'm sure many of us heard about the suicide of a state policeman, 35 years old, a couple of weeks ago, right out on the Van Ryan Expressway. So again, when we look at this sense of urgency, this crisis is really apparent, is very real, is very present, and is creating extreme desperation in many segments of our society. So when we look at social determinants, we realize that these health inequities have persisted across generations. It didn't just happen. And because of structural policies and practices that have systematically limited health access and opportunities, they impact one's ability to function, one's ability to be able to grow and develop, and again, create opportunities for folks to be meaningfully involved in society and make meaningful contributions. Next slide, please. So when we look at interventions that target, in particular, social determinants of health, we have tremendous potential to begin to narrow the disparities across many chronic diseases by removing systemic and unfair barriers. And we then engage in the practice of healthy behaviors. So again, to address social determinants of health in particular, we are able to make progress towards health equity and achieve a state in which every person has the opportunity to attain their highest level of health. And again, let me point out that looking at notions of chronic diseases and thinking about the impact of the ADA and other major policies that have been created to address these inequities, that's in part the way it's done. In fact, I often look at what is called a pestle analysis, which is a strategic way of looking at the environment and doing an environmental scan and making a determination about the different multiple factors that exist. So when you're talking about social determinants of health, you can also look at the pestle analysis, which is an acronym that stands for political and environmental, social, technological, economic, and legal aspects that affect our well-being. So laws, policies, practices, environmental concerns, all these different issues affect the ability for one to be fully engaged in society and fully be given an opportunity to be gainfully employed. Next slide, please. So as we begin to focus the conversation even further, the National Disability Institute began to talk about the financial impact of systemic inequality and its intersectionality. So today in the United States is facing two concurrent crises. The COVID-19 pandemic, as well as the widespread recognition of historic and systemic racism that disproportionately impact Americans that are Black, Indigenous, and people of color, BIPOC. Of course, with George Floyd's murder last year, we realized and everybody realized this injustice, and it was televised in such a way that many people had never seen before. But the reality of the situation is that this type of injustice, this type of trauma has been experienced for generations, and some of it has been supported systemically. So BIPOC Americans with disabilities face unique systemic challenges as a result of their intersecting identities. Systemic injustices lead to economic inequality. As we reflect on these advances that have been achieved with the passage of the American Disabilities Act, this promise must cover all individuals with disabilities, regardless of race, ethnicity, gender, and sexual orientation. I had the privilege of participating in the Mayor's Equal Access panel years ago, along with Mark Abisto of Access Living, Audrey McCrimmon, who eventually became the director of the Department of Rehab Services. We all sat around and talked about how we could ensure that the city of Chicago's Central Business District became the most accessible business district in the country. And with that particular focus, with that particular intent, there was every city department of planning, special events, sanitation and streets and sanitation. Every city department was sitting around the table talking about how we could in fact incorporate the tenets of the American with Disabilities Act into city government, in terms of hiring practices, making sure that reasonable accommodations were being made in terms of physical barriers, social barriers, attitudinal barriers. All of that was being done, sitting in this planning session. And it was indicative of what could happen when you bring different perspectives to the table that address disability, that address the systematic injustices that have been rampant in this country towards Black Americans and other Indigenous and people of color for years, for generations. In fact, we now know that there is DNA research that supports the notion of epigenetic impact. That is, in fact, that trauma, the experience of trauma in previous generations can then be carried on in terms of a DNA trace gene into future generations. Think about it. That trauma from generations, because you're Black, a member of an Indigenous entity, or any person of color, that experience of trauma now can be potentially transferred into the next generation. These are the issues that are addressed increasingly and more intensely when you're looking at the perspective of that BIPOC population. Next slide, please. So centuries of exclusive practices in the United States, such as redlining, employment discrimination, have resulted in a society where people of color with disabilities, particularly BIPOC and Latinx communities, are at a particular disadvantage financially. So building on the National Disability Institute report in 2017, they noted that financial inequality around disability, race, and poverty in America, and the updated research on the financial conditions of individuals grouped by disability status and racial ethnicity and identity reflects that individuals who live at this intersection of race and disability experience disproportionate levels of financial distress. Ladies and gentlemen, even today, on a race poverty continuum, persons living on the west side of Chicago, there are places that you can visit, places where people live, their apartments. You would not know if you were in the west side of Chicago or in parts of rural Mississippi. The poverty, the condition of living is just that bad. Some folks who are Black, who also have a disability, don't have accessible facilities to live in. There are persons who are pulling themselves up to the second floor of their apartment with no accessible lift. Imagine living in a poverty condition, infested, potentially with lead-based paint, plaster hanging from the walls, in some cases, no hot water. And now you've got a disability and you're trying to get to your apartment. Maybe in the wintertime, that's also cold because of lack of heat. The poverty conditions are real. The in particular challenges of people of color with disabilities is real. When you take it to another level and you look at the violence that has been rampant in the streets of Chicago, and especially on the west and south sides of Chicago, we also now realize that younger people are becoming disabled as a result of gun violence. Many of these persons have been purposely shot in the spine to create quadriplegic and paraplegic conditions. That is correct, ladies and gentlemen, that it has been testified and witnessed by many that in some gang activities, purposely people are shot in the spine to disable them so that they can be an example of what not to do with a particular street gang. So we've had this trend and this concern going on for the last 20, 30 years in parts of Chicago, but it's been under the radar screen. But it's yet another challenge when we talk about the particular concerns that we face, with people with disabilities that are also people of color. Next slide, please. So the Equality Act of 2010 talked about the responsibilities of employers and their legal duty to provide support for workers with chronic illness. The Equality Act of 2010 requires that employers make reasonable adjustments in the workplace to prevent employees from being treated less favorably than others for reasons related to their disability. Now, keep in mind, I've always looked at this component and we've got to embrace it in its particular form. You have barriers to employment, barriers to housing simply because of the skin color. Now, with the disability, there may also be issues that create a level of discrimination that this particular law had to address. So yes, reasonable adjustments must be made. Folks with disabilities in the workplace must have the opportunity to, ensure that they have fair treatment, to ensure that they have an opportunity to continue to progress in an employment career if they decide to do so. So the conditions covered by this act are physical or mental impairments that have more than a minor or trivial long-term adverse effect on a person's ability to carry out normal day-to-day activities. Supporting our employees with chronic illness or chronic health conditions can also minimize potential costs of long-term absence and staff turnover, and can encourage productivity, job retention, and in fact, quality of life. Furthermore, it can retain the experience, knowledge, and skills of a worker. We have found, and research does in fact support this, that persons with disabilities are among the most dependable workers in our society. At one point in time, Habilitative Systems, Inc. were in fact manufacturing and producing thousands of disposable pillows for the airlines. Eastern Airlines, when they were in business, United Airlines, Amtrak passenger lines. We even constructed and assembled over 8,000 telephones for the Democratic National Convention back in 1996. We never had to worry about persons with disabilities showing up for work. And like clockwork, we were able to ship those pillows out, and shipping pillows, thousands of pillows, to Los Angeles, to Philadelphia, to Washington, D.C., here in Chicago. And in fact, the only reason why that contract was discontinued was because of 9/11. And I'm sure most of you all can witness and attest to the fact that very rarely, if ever now, do you get a pillow on an airline. That particular perk has been discontinued. And that basically impacted that entire business for people with disabilities who are working in a very significant capacity, making a really great product. All of a sudden, that whole business was gone. But again, in terms of dependability, there was no question that we could get the product taken care of because we could depend on our workforce being there. Next slide, please. So, of course, I don't want to just talk about all the problems and all the challenges that are faced with, employing people with disabilities, and especially people of color, the BIPOC population of folk, in terms of employment and disability. We want to talk about some tips to manage chronic disease, and also talk about some possible solutions, because we want to talk about the person being served. We want to talk about the staff. We want to talk about the caregivers. We want to make sure that every level of service is being impacted, by what we're really looking at and recommending today. And I'm going to be concluding in a minute, so that if there's questions and additional discussion points that you'd like to entertain, you will certainly have the opportunity to do so. So, if you're a person with a disability in an employment situation, you certainly want to have a discussion with your supervisor about how you would like them involved in your chronic disease management. So again, there should be some reasonable accommodations made. Employee assistance opportunities are there. The Family Medical Leave Act is there if necessary. But this sensitivity on the part of the employer needs to manifest and needs to be a part of the company's policy. So of course, it begins with a discussion with your supervisor, or a discussion with the HR department about reasonable accommodations, and seeking out their support, and you being able to manage your chronic disease in the workplace. You certainly want to set up an open channel of communication between yourself and your coworkers. Oftentimes, this is a very, very touchy subject, and coworkers sometimes are somewhat resistant, or I shouldn't say resistant, but maybe sometimes not feeling very comfortable about having discussions about your particular disability. Now, you look at a child. If a child was to see you with any particular challenge, of course, as an amputee or what have you, they'll immediately ask you the question, what happened to you? Out of curiosity and out of concern, they want to know. But sometimes for a coworker, that's a very sensitive subject. They don't know how to introduce the conversation oftentimes. So there has to be a level of open communication about discussing, potentially what happened, how it's affected you, and your determination to continue on to be gainfully employed, and that you seek out their support and understanding in the process. And this is all part of peer support. We may very well find that there are persons in the workforce that have invisible disabilities, not as prevalent, not as visible, and yet have been challenged emotionally and experiencing some degree of anxiety and depression, trying to conceal their disability and their concerns about their disability. So again, opening up this communication really creates an opportunity for a more sensitive and supportive work environment. The next item, of course, is making sure that the employer provides reasonable accommodations around your condition and being understanding when it comes to chronic health issues at work and social determinants of health. Of course, the ADA lays out these provisions very clearly. You can also visit the website for the Job Accommodation Network. They've got just loads of recommendations about ways in which accommodations can be made within the workplace and ensure that you have the opportunity to really continue to be gainfully employed. The other thing that's important for both the person served, the employee, as well as the employer, is to explore ways to save on your energy. And that is TEA. I'll get a little bit more into that in the next slide, but that is looking at your thoughts, your expressions, and your actions while working without having a negative impact on productivity levels. Of course, some of you all are familiar with mindfulness and being able to take mindfulness breaks throughout the day and creating a more mindful place of business. That basically just means focusing in on the moment, creating an opportunity for you to relax, to re-energize yourself, and create an opportunity for you to be able to be restored even in the course of the day. But we'll get a little bit more into that. We also recommend looking at establishing a chronic disease plan in place for chronic illness at work. So everyone knows what the expectations are and how to manage their chronic disease. So if your coworker or your supervisor sees you having a particular challenge at work, they know about the nature of it and they know how they're supposed to provide a level of support for you at that time. Next slide, please. So I mentioned TEA a little bit earlier, and these are a few things I came up with years ago, and a few I borrowed from a few others. But it's all about your thoughts, your expressions, and your actions, and this being a very mindful and a very conscious process. The first affirmation, if you will, is basically having more altitude in your attitude and an attitude of gratitude. Being able to begin one's day, even though you may have, physical challenges, some mental challenges, being able to, begin to affirm on a daily basis, this kind of attitude of gratitude, being grateful for the opportunity to move forward, that you've got the opportunity to work, that you've got the opportunity to have, supportive coworkers or an employer who understands your condition, or you've got an advocacy group who's working with you, to really battle the addiction or battle the disability and create more functional opportunities. That's the attitude of gratitude, looking at the next opportunity to be able to increase, your life of your lifestyle, your level of living, your quality of life, and of course, another opportunity for growth. The next thing, of course, is supervision and insight. I often like to use this word supervision. If you're a supervisor listening to this conversation, yes, you are supposed to have supervision, a level of insight that can provide opportunities for your subordinate staff to understand, that they have a mission. It's not just a job, but in particular, when you're working with people with disabilities, it's got to be more of a mission-driven experience and not just a 9-to-5. And that is what the supervisor, the person who possesses supervision, can help install and instill within the persons that they work with. This notion of insight and more compassion for persons served. The next notion is one of vacate or vacation. We've got to give ourselves a break. We've got to recreate. We've got to create this recreational opportunity. And that is making sure that you can do things that give you a level of satisfaction and getting away from the intensity of the moment, the intensity of the situation. Sometimes to vacate in a moment means that you just take a moment for 15 minutes to do a slight mindfulness exercise, a yoga exercise, or something that allows you to relax, deep breathing, positive affirmations, autogenics, something around self-talk, lifting you up. The next principles, really relate to observation. So much knowledge is gained by our ability to observe what's going on in terms of our feelings, our emotions internally, and being able to observe what's going on within our external environment. So to be able to observe and gain knowledge of the internal and external conditions within and external to ourselves gives us more knowledge and then builds our consciousness about what to do and how to do to be more effective in the workplace. and to, in fact, have the type of impact that we really want to have. If it's, more control over ourselves and our own emotional state, or is it being able to, influence our coworkers and our employers about being more advocacy focused on issues and the plights of persons with disabilities? It's all about and begins with your ability to observe what's going on within yourself, within your environment, getting the knowledge, doing the work, doing the research, and then building the consciousness and raising that consciousness, not only of yourself, but those around you. The next thing I talk a lot about with our peers who are battling recovery and in recovery situations. And they often talk about, 12-step plan, a 12-step plan, and also talk about, of course, one day at a time. Often say, well, guess what? It doesn't take one day, in terms of a decision or a choice that can make you a victim or victorious. So in every moment of life, not for the whole day, but in every moment of life, we want to make a determination as to whether or not, we are going to take on a position of being victim or victorious, advocate, or a person in a position to be, again, beat down by the circumstance or beat down by the situation. And again, we know based on my earlier dialogue and conversation, all the systemic issues that are coming at us daily as people of color, in the BIPOC, group. We understand this, we understand that, but guess what? This is a continuation of the struggle, from the time, over 400 years ago, during slavery forward. There's always been a battle, there's always been a struggle. And if at any point in time folks said, I'm done, I'm going to be a victim, I'm not going to try anymore, we wouldn't see what we're seeing today in terms of the civil rights, women's rights, disabilities rights, gay rights. We wouldn't see it, okay, if people at any point in time determined that they want to be victims and not continue to fight to be victorious. So this, of course, is about being able to cultivate the legacy. The legacy of advocacy, the legacy of continued struggle, the legacy of continued uplift despite the adversity, achieving despite adversity. That's what this is all about. And it begins when you have the opportunity, to have strong advocates as a self-advocate, to have persons around you who are advocates, or friends and supporters who can make sure that you can really achieve the dreams that you have for your life. And in this particular aspect, I often say that aspiration without self-discipline is ineffective. And we must have a definite chief aim in life. This is what Napoleon Hill talks about in his book, Law of Success. Your purpose-driven perspective, your focus really helps to get you there. And last but not least, of course, looking at your SWOT, your strengths, weaknesses, and opportunities and threats, both internally and for the organization. Where are the strengths, weaknesses, opportunities, and threats? Strengths and weaknesses are an internal focus. Opportunities and threats represent an external focus. Next slide, please. Then, of course, advocate sustenance. This is about taking care of you. 30-day mental diet, okay? What is that? For 30 days, begin today. Only entertain thoughts that are purposeful, beneficial, and worthwhile. Thoughts that continue to motivate you, inspire you, lift you, keep you focused doing the kind of work that you want to do. Auto-suggestion, positive mental attitude. That's what you say to yourself. That's self-talk. Every time you are entertaining a negative thought or a defeating thought, you got to say to yourself, that's not the thought I'm going to have. I refuse to accept that thought. Let me focus more positively. Critical thinking. Again, looking at what you must do to think very analytically. I talked about the puzzle analysis, the SWOT analysis. That's the ability to engage in personal management, taking care of yourself. Cognitive behavioral looks at your thoughts and your behaviors. It's what you think and what you do. Cultivate a learning organization. In order to be more sensitive to chronic disease in the workplace, we must create a learning organization. Peter Senge talks about that in his book, Cultivating the Learning Organization. So we want to be able to talk about how do we learn, how do we grow, how do we develop a greater sensitivity for people with special needs within the workplace. Then we want to look at the dis-ease balance. Rather than talking about disease, let's understand that it's really an imbalance, a dis-ease, a discomfort within our system, within ourselves, something that just makes us feel uncomfortable. So we look for this balance, and many exercises help to give you more balance. Choice, power of speech, is what you say. You know, is it that I'm a person with a disability, or am I a person that's got physical challenges, or I'm unique? How do you describe yourself? The power is in the spoken word. So choose how you define yourself, empower yourself, and lift yourself through the power of speech. Person-centered. Of course, we got to have the focus on the individual, you know, and we realize that when we come up with planning that's person-centered and then use a strength-based approach, we create the maximum opportunity for persons to succeed. And last but not least, we want to talk about energy management. Okay. And with that, what is that? You got to manage your time, you got to manage your stress, you got to make sure that your energy is balanced. You know, when you need to take a mental health break, give yourself a mental health break. Give yourself a break today. Give yourself what you need to be sustained and uplifted. So let me pause for the cause and certainly entertain any questions at this time or any discussion points.
Yeah, anyone can feel free to post questions in the chat and I can read those off. Or if you'd like to unmute yourself and ask a question, feel free to do so. In the meantime, I'm going to put a link to the web page that we have here that you'll be able to get on later if you want to rewatch this presentation or rewatch any of our presentations. That was a wonderful presentation. Thank you so much for doing that for us. I know I learned a lot.
Thank you. Appreciate the opportunity.
I see that Teresa Parks noted that appreciating the information and self-reflection as well as the reflection of organizational needs. Appreciated learning that.
Thank you so much, Director. Appreciate that.
Well, I'd just like to remind everyone to again click on the website that I just posted in the chat. You'll see that our next session begins here at, let's see here. I'm looking at the schedule to confirm. So we have a 15-minute break until 1:15, and our next session is a policy panel at 1:15. So would love to have you join for that. And I'm not seeing any other questions. So we'll wrap up here. Donald, did you have anything you wanted to add before we wrap it up?
No, just I really appreciate the opportunity to participate in the forum today, Molly. I think that our director, Patrick, and her leadership needs to be saluted. We appreciate the Illinois Department of Human Services and all the other divisions within DHS who are battling and struggling and advocating on behalf of our special needs every day. We appreciate, you know, the opportunity to partner with DHS, DOORS, DD, DMH, and SUPER to really make a difference in our communities. And we're not going to stop for as long as we can. We're going to continue on. I've removed the word retirement from my vocabulary. I said I stopped working a job many, many years ago. So we want to keep our folks inspired, keep on fighting a good fight. And again, we appreciate you. Take care of you.
Thank you so much, and thanks for joining us, everyone. We will see you at other sessions later today.
Thank you.
Bye.
Bye-bye now.